All right, we'll go ahead and get going. So I know we still have some folks joining us, but we want to be timely and we really appreciate everyone hopping on who's on. Just so you know, as you joined today, you would have seen that we're recording this webinar because we're wanting to post it at a later date on our website. So just know that's the purpose of recording today. We're really, really, really happy that you can join us, or if you're watching this in the recorded version. This is really exciting for our team. And as I'll talk about acknowledgements right away here after I talk about our team, this is really more than a year's worth of work that a lot of people helped with. And so it's just really exciting to get to share today what you're all here to learn about, which is sex behaviors of youth in Utah. So we are presenting our findings from the 2021 Utah College Sexual Behavior Survey. So just to kind of introduce you to our team, if the slides will go forward. So almost all of our team will present today. You're going to have a lot of different people speaking. We just have one person who couldn't make it. So I'll kind of go through the list so you know who's talking. And it's kind of an exciting team in that we come from diverse fields of study. And so it really adds to, like, when we are creating the survey and all the work we've done with advisory boards and stuff, brings a lot of perspectives. So my name's Meier. I'm the PI on the project, and I'm an assistant professor in the social work department at Utah State University. I'm also the extension community resource and economic development specialist, which is what I spend most of my time doing here at USU. My co-PI, who's been with me since day one of the project, she hasn't abandoned me yet, is Julie Gast. So she is a professor here at USU in the Health Education and Promotion program, and she's the director of the Master of Public Health program as well. Tyson Brett, who couldn't join us today, is a research assistant professor in psychology. He has really helped us, along with Demi, who I'll introduce, do a lot of our work that we're not presenting today related to the reliability and validity of our measures, but he's been instrumental in that. Our first doctoral student working on this project with us is Melissa Ferguson. She's a doctoral student in the Human Development and Family Studies program, and this is her area of interest. So it's really great to have Melissa bring her expertise to the project. And then Dumi Koulianos is here as well. She's a doctoral student in the socio-behavioral epidemiology study, and she has really worked, really spearheaded the effort with Tyson to do some work around our reliability and validity of our measures that, again, I'll introduce, but we're not really presenting today. And then finally, Lily Ward, she's a master's student in the social work program. And Lily will soon go from master student to just research assistant because she'll be graduating. So that's exciting. So moving forward, usually we do acknowledgements at the end. However, I thought it was appropriate to actually start with acknowledgements. So while our research team here is presenting this information to you, it's really important to acknowledge that there were so many people who made this work possible. So I want to start with our USU Student Affairs Office. Without the support of our USU Student Affairs Office, we would not have been able to disseminate it to our students the way that we did, that we'll talk about. Not only did they help us disseminate it, they also helped us look at the measures, talk through key things we could look at for USU to understand how we could better serve our students. Really, they were instrumental in getting our survey out to folks, and we appreciated the help that they gave us. We also had 2 small grants from the Mountain West Center and from the Center for Intersectional and Gender Studies at USU. So we want to thank them. And this is where we get to the folks down here that really were in it for quite a while with us and did a lot of work. So we had formed a USU advisory board of key stakeholders at USU, both in Logan and statewide. We had both representation. And we want to thank them because they spent time helping to perfect the survey, talking about how to get it out, talking about what we should do to make sure we're on the right track. They were really instrumental in helping us get the survey formed. We also, as I'll talk about, want to thank our LGBTQ identifying students and orgs that work with LGBTQ, the population in Utah, because we tapped into them to help us really perfect the survey and make sure it was inclusive. And then the Utah Department of Health, I just want to mention them, and it goes into the backstory of this project. So I really want to thank the Teen Pregnancy Prevention Coordinator at the Utah Department of Health. Her name is Elizabeth Gerke, and to kind of transition us to why this project happened. So Elizabeth, I was meeting with her. I'm interested in getting into sex education. It's not my area of background of research. My background is more in food environments and program evaluation. And I met with Elizabeth, and Elizabeth said, we just simply don't have any data about sex behaviors in Utah. And I was like, oh, okay. And I was like, okay, well, how about I do that? And she's like, oh, really? Okay. And so I went to Julie, and she said, oh, yeah, I can do that with you. And that's how this project really formed. So the background here too is that Utah is only one of 3 states that doesn't collect sexual behavior data through the YRBSS. So we only collect one measure about HIV/AIDS testing. Otherwise, we don't collect information. So this becomes a real barrier programmatically when we're trying to create data-driven programs, because we have the evidence-based programs available to us that we can use, but it's hard to use the data to drive our programming when we don't really know what's going on with our youth. The other thing that came up in these discussions with Department of Health was, so many of these surveys are really heteronormative. So when we are thinking about our LGBTQ identifying population, there's not response options or definitions or, experiences that reflect their own. So we really worked hard to make sure that this survey was inclusive, so that when we had our LGBTQ identifying population taking the survey, they felt like they were represented and they had choices that reflected them. So we had 2 research aims that guided our project. So the first we're not really talking about today, but I still want to mention it. So the real goal of this first survey that we're talking about today was to really create a retrospective survey that was valid and reliable and inclusive. So we didn't really expect the response or the sample that we ended up with. We really thought we would end up with like 200 or 300 folks, and that's all we would get. And that would be enough to test the reliability and validity of the measures, so that then moving forward in a next year, we could do more of a generalizable study. However, we had really, really good participation of the survey, which we'll talk about. And so our second goal was to really understand retrospectively the sexual behaviors of youth in Utah. And this includes like sex education and some other components. So as you'll see, we were very surprised by our sample, and we're able to really look at both of these research aims pretty effectively. So the survey creation I've already kind of mentioned. This was a labor of love. Like, this was not a quick survey creation at all. This took 9+ months, a lot of devotion by the team to make it happen, and that participation from a lot of folks. So like most research teams, we really started with an initial draft of survey items. So we looked at any retro items we could find, which we didn't find any, or retrospective, excuse me. And then we also looked at just current youth questions. We used the YRBSS questions, and then we worked on trying to make them retrospective. At the same time, as we are forming our advisory board to help guide this study, they kind of said, hey, you should talk to someone at USU Student Health Services to hear from their perspective, what are students saying about, what do they know sex education wise? What are they prepared for? Those kind of things. So we did that, and that really started informing the development of a couple of USU specific questions that we'll share with you in a minute. Meanwhile, we're working with our advisory board to kind of look at the questions that we formed. And in addition to questions, we had a very long list of definitions we were also using, because we didn't want our participants to have any questions about, well, what does this mean? Or because once you start talking about penetrative sex versus non-penetrative sex, well, what does that mean? So we were working with our advisory board and Department of Health and a number of folks to really work on refining these, making them so they made sense, and making sure they were inclusive for everybody. So once we had that kind of going, then this was the really big ask of our LGBTQ students and orgs. So we did 2 things, kind of generally at the same time. We started with our orgs, where we said, all right, orgs, is there any way you can review this long list of definitions? And there were 15 specific questions we wanted them to look at. Can you please help us improve them to make them more inclusive? And so they did a really good, they gave us really great feedback. This is where our use of non-penetrative versus penetrative, which we'll define in a little bit, comes from. But really, we got some really great feedback that made sure the definitions we were using were inclusive. We also did think alouds and pilot testing with LGBTQ students. And so this was after the orgs, where we were really trying to make sure that our measures had face validity. And really the measures performed really well. In general, we didn't get a ton of changes that were needed, but we did get some ideas for response choices and things like that. And then after all of that, we go back to the advisory board, back to the Utah Department of Health. We also have the LEAP group here in Utah that everyone was looking at the survey, helping us finalize it. And after 9+ months, we have the survey we're going to talk about next. So Julie, I'll hand it to you. Yep.
Okay, I'm going to talk about the methods, procedures, measures, and analysis that we used for this project.
Sorry, it's stuck. Oh, no.
Okay, so we used a quantitative method design using a one-time cross-sectional design, and we used a Qualtrics survey for that ends, and it was a convenient sample. So emails were sent through the Student Affairs office. And of course, at first, as Chris mentioned, we had to get approval from the Vice President of Student Affairs, who was fantastic to work with. And based on that, we sent more than 11,000 student emails across USU campuses. So some of you might not be familiar that USU has campuses all over the state of Utah, not just in our main campus in Logan. This list was generated in collaboration with the registrar's office, and we asked the emails be sent to only students at USU who were between the ages of 18 through 21. And so after that, we sent out this survey on September 7th of last fall. The survey was open for 3 weeks, and we did not send reminder emails. We incentivized students to participate by the chance to win free Aggie Spirit Gear. So in terms of measures, students were kind of pointed in one direction or the other, depending on how they reported, if or they had penetrative sex during high school, or if they had non-penetrative sex through high school. So if they engaged in penetrative sex, we asked them the number of partners they had in high school or earlier, use of drugs or alcohol use before penetrative sex, age of first encounter, and the frequency of conversations related to sexual health, such as consent, STI status, etc. If a student reported having non-penetrative sex in high school or before, then we ask them again of age of first encounter and the frequency of those sexual behavior type conversations, such as consent and STI status. We were also very interested, based on the literature review we did, on other behaviors associated with sexual risk-taking of youth, and this includes sexting and substance abuse. So in terms of sexting, we asked 8 items that asked about receiving, viewing, or sharing sexually explicit images. And we also asked about substance use and including those things of age at first use, including alcohol, vaping, etc. We wanted to know about contraceptive use and STI prevention for those students that reported engaging in penetrative sex. And these were things such as use of a condom, method of STI protection, if any, and method of pregnancy prevention, if any. We were also interested in their experiences with sex education and their self-report knowledge on sex education topics in high school. So we had 2 items that rated their knowledge and amount learned related to HIV/AIDS education. We asked them about modes of sex education, so where they received information, and this could be formal or informal, such as the classroom, friends, internet, etc. Sufficient amount of information they received regarding sex education topics, so there were 5 items on this, and we asked things such as healthy relationships, exploring their sexual identity, etc. We also wanted to know if they felt they were exposed to enough sex education while they were in high school. And we wanted to know if they had confidence giving and obtaining sexual consent in high school. We then also asked level of preparedness and confidence related to sex for the first time. We wanted to know about their current sexual attitudes and sex behaviors. So this was in college, not in high school. We asked about the level of comfort with their sexuality, We wanted to know about their attitudes towards sex, which we call the sex positivity scale, that included 7 items. We wanted to know the number of sexual partners since leaving high school. And we also wanted to get information on programming at USU. So we asked students to rank their interest in 15 programs. Of course, we also asked about demographics. So based on their credits they had taken at USU, what year they were in school, what county they attended in high school. So we wanted to kind of get a feel for rural versus urban location. We wanted to know what campus they attended at USU, their race, ethnicity, their family income in high school, their self-reported gender identity, sexual orientation, religious affiliation, and their current relationship status. And so based on that, the people that remained in our study, they had to have attended high school in Utah. They had to report that they were between the ages of 18 and through 21 when filling out the survey. Our final sample consisted of 1,174 students. As you can see, we had a nice spread of age distribution, but the majority were reported being age 18 years old. And the majority attended the Logan campus, 89%. In terms of our data analysis, what we're going to be talking about today is our univariate analysis. And we're in progress of quantifying or using the qualitative data to group by category, but I don't think we're going to report that today. But that's something we had some open-ended questions in the survey that we're going to be looking at.
So I'll be presenting the demographics of our study. So this figure shows the distribution of participants by self-reported academic credits. So participants most often were freshmen with 37.6% and sophomores with 28.1%. This table shows that participants most often reported attending high school in Salt Lake County. And then Salt Lake County, along with Utah, Cache, Davis, and Weber counties, make up the top 5 counties that participants attended in high school. Most of our survey participants attended the Logan campus at 89.3%, with Price being the second most frequent campus of attendance. And this table shows the top 5 most frequently attended campuses by participants. So our sample was mostly white, and it does have a similar distribution to what Utah's demographics are. So family income is one indicator of socioeconomic status. So in our sample, most participants did not know their family's income in high school. And then the next most frequent response was families earning over $125,000 a year. So participants identifying as female make up the majority of our sample, which is over 65%. And then participants identifying as male were the second largest gender identity. And then additional identities were also reported, such as identifying as more than one gender, transgender, and gender nonconforming. So this figure here illustrates each rectangle representing a single individual. So the majority of the participants identified as being heterosexual at 75%, but with the other sexual orientations making up 25% of the sample, so there was still some good diversity in there. The majority of our sample was LDS, with non-religious being the second most frequent category selected. Most of our participants were not in a committed relationship, 67%. But of those 67%, the majority of them wanted to be in a committed relationship within the next 5 years.
So now we're going to shift gears a little bit and talk about the survey results to the questions about non-penetrative and penetrative sex. We tried to be inclusive to those in middle school, as we recognize that some of those students did engage in non-penetrative or penetrative sex during middle school. So I will try to differentiate the questions that were asked about middle school behavior, high school behavior, or both. But recognize if I don't highlight which time period the question was asked about, you can find that in the full report that we will share at the end of the webinar today, or just unmute yourself and ask. So before we go into the results, I do want to take a second to define the key terms for this section. So as you can see, non-penetrative sex is the intentional and consensual touching, either giving or receiving, either directly or through the clothing of the genitalia, anus, groin, breast, inner thigh, or buttocks. Whereas penetrative sex is regardless of the other partner's gender. This is involving, again, the consensual penetration of the vagina or anus by the penis or other means such as dildo or manual or oral intercourse. So students were provided these definitions to inform their responses, as Chris highlighted earlier on. All right, so one of the sections of our survey did ask students whether they had participated in non-penetrative or penetrative sex during middle or high school. So as you can see here, just under half of our total sample had engaged in non-penetrative sex in middle or high school, in comparison to 18.5% of responses saying that they had engaged in penetrative sex in middle or high school. So to get a sense of how sexually active penetrative respondents were, we did ask them to reflect on how many penetrative sexual partners they had. So again, this is just asking, this question was just prompted to the people who said that they had engaged in that penetrative sex. So as you can see, over half of our respondents had only one penetrative sexual partner, and the remaining of the results indicate that those who engaged in penetrative sex generally had 3 or less than 3 penetrative sexual partners. So in another section of our survey, we did want to understand risky sexual behaviors, as they are really predictive that a person will engage in that sexual activity. So in this study, we did ask questions about drug and alcohol use prior to engaging in penetrative sex. So as you can see on the slide from the responses, it was reported that just under a quarter, so 19.4% of penetrative sexually active partners did use alcohol or drugs before having sex. So the next question that yielded important findings is regarding the age of first non-penetrative or penetrative sexual interaction. So as suggested by the table, the older the individual was, the more likely they engaged in both non-penetrative and penetrative sex. So something interesting to note is that the younger the individual, the more likely they are to engage in penetrative sex in comparison to that penetrative sex activity. So this is really consistent with our results from respondents younger than 13 years old, and then 14 years old. So like all sexual interactions, both non-penetrative and penetrative, research does show that having conversations about consent, STI status, or testing, and then contraceptive use increases the safety of involved individuals and may really contribute to a more positive relationship and interaction. So we wanted to ask the same questions about these behaviors to folks who responded that they engaged in non-penetrative folks. But here we'll highlight the important and interesting findings related to penetrative sex specifically. Again, if you're interested in kind of the conversations related to non-penetrative sex, you can find that in the full report that we'll share at the end. So in relation to penetrative sex, though we asked several conversation-based questions, I do want to take a look at sexual consent, for example. So of those who responded that they had engaged in penetrative sex in middle or high school, most often people responded that they always spoke about sexual consent. However, really, this is only 42.9%, and there is much more variance in the data than we would hope to see about communication prior to engaging in penetrative sex. So the next section of the results that I want to share with you is in relation to those sexual risk-taking behaviors that I noted earlier. So on this slide, we will report the responses from some of the questions that asked about sexting, as this is a sexual risk-taking behavior. So the highest response rate indicating that they had engaged in sexting behaviors was in regards to receiving a sexually explicit image. So that first row there. But this was followed by receiving pressure from someone else to send a sexually explicit image. So as you can see suggested in the table, the majority of respondents indicated that they had not engaged in the 4 response options that are highlighted here that were related to kind of this explicit image, indicating that really sexual behaviors in high school were fairly low among our sample. So as I mentioned earlier, we did ask respondents if they had engaged in penetrative sex and partook of substances prior to engaging in that sexual activity. But we also asked respondents the age at which they first tried a given substance, as this is a sexual risk-taking behavior that predicts engagement in sexual activity. So though we prompted respondents with several different substances, here we only really were reporting just the most interesting. So as you can see, the majority of respondents indicated that they had never consumed this substance, followed by trying the substance after leaving high school, upon turning 17 years or older, and then during the ages of 15 or 16 years old. Another section of our survey that's important to discuss is contraceptive use in efforts to prevent sexually transmitted infections or pregnancy. So these results are related to penetrative sexually active survey respondents. So in relation to condom use, 48% of our survey respondents indicated that they had or their partner had used a condom when using penetrative sex or when having penetrative sex in middle or high school. Whereas the second question, the middle column there, asks the form of STI prevention people use. So of the response option, just over half of respondents said that they used a condom as their main protective measure against STIs when having penetrative sex. And then lastly, the third question asked about pregnancy prevention methods. Here, 31% of our respondents had used a condom as their protection against pregnancy when having penetrative sex in middle or high school. However, I did want to highlight that this is closely behind the pull-out or withdraw method, where 25% of our respondents said that their the pull-out or withdraw method was their main protective measure against pregnancy. So now I am going to be turning it over to my colleague who will talk about sexual education and knowledge.
Hello, everyone. I am delighted to tell you about what we found about sex education and knowledge with the participants in our study. So as Chris mentioned, there is one YRBSS question that is asked to Utah students, and that's regarding HIV and AIDS prevention. So this is the question that is comparable to data we do have in the past. Also, as an important point, STI prevention is one of the few requirements for Utah sex education. So it should be expected that the students in this survey would know something about HIV and AIDS prevention, which is reflected in our survey results. You can see that the majority fall between a fair or good amount of rating HIV and AIDS prevention knowledge in high school, as well as they said that they learned only a little or some about HIV and AIDS in high school. We had asked about modes of sex education, so where are these students learning about sexuality and sex education? The majority did say that they learned from the classroom. The largest percentage said that they had learned from the classroom setting. However, you can see that more than half found information from talking with friends, talking with family, and through internet searches done on their own. It is interesting to note that the smallest percentage indicated family education. All participants were asked if they viewed their high school sex education class as sufficient in providing knowledge on these 5 areas, you can see that more than half in each one of the areas stated that it was not sufficient. But it is very striking, this disparity between insufficient knowledge regarding exploring sexuality and LGBTQIA+ orientations and relationships in an unbiased manner. The majority, about 64%, said that they desired more sex education in high school. Of note, about a fifth of the sample said that they were not confident in obtaining sexual consent, and just over a quarter stated that they were not confident giving sexual consent. So I did want to make this connection of the percent that said that their sex education was adequate is the same percent who said that they are not confident giving sexual consent. It is important to know what sex education is happening because we found that the majority of folks in this study said that they were unprepared or very unprepared for their first sexual encounter. In addition to attitudes, in addition to sex education knowledge in high school, we asked about current sexual behavior and attitudes of the college students. You can see that for the most part, students said that they were pretty comfortable with their own sexuality, but it is also important to note that over 10% stated that they were very uncomfortable with their current sexuality. The sex positivity measure was created specifically for this survey. This was to assess the positive attitudes towards sex and sexuality that individuals hold for themselves. It was rated such that strongly agree would be indicative of more positive sexual attitudes. Except for this first item, this was reverse coded so that the strongly disagree was actually indicative of more positive attitudes. For the most part, sorry, can we go back just a minute, Chris? For the most part, they're generally more positive with sexual attitudes. However, we can see the most variability in this item of sex is only for the purpose of reproduction. I am aware of my own sexual needs and I value giving and receiving sexual pleasure. This is important to know because we know that sexual communication is very much tied to sexual positivity, and sexual communication is tied very closely to sexual satisfaction and relationship satisfaction. We also asked about number of penetrative sex partners since leaving high school, and it pretty much reflected what was said during middle school and during high school, but it is important to note over half said that they still have not had penetrative sex, followed by one person as a sexual partner. We had asked current students which programs they would be the most interested in, and we asked them to rate from 1 to 15. We are presenting only the first 10 in this slide. Of note, the first 3 are very closely tied to what we found as missing in the sex education. So dynamics of a healthy relationship, understanding and navigating consent, and choosing to love yourself because you owe yourself.
All right, great. And so I'll be kind of wrapping it up here and then we'll turn to questions because we're excited to answer any questions that you all have. So we just wanted to highlight some 3 key takeaways, and Julie said 3 takeaways, so I went with 3. I wasn't going to go beyond 3 because I think there are a lot of takeaways because we're very excited about this data. So I could probably talk all day. So I'm going to say 3 things. I think the first thing is, as we all suspected, youth are in fact engaging in non-penetrative and penetrative sex. So before, of course, we knew that they were, but now we have some numbers to say, look, we do have sexually active youth in Utah. And this really helps, I think, inform programming. So it's great to know generally what it's looking like. You know, the results really clearly point to the need for additional sex education in Utah, and that not only that we need more, but the youth would like more. So I know that they're retrospectively thinking back to when they were youth. And, that is a hard kind of way to measure that. But really, when they're reflecting back, they're like, yeah, I could have used more information about those things. So I think that's really important to note for our orgs who are out there doing this kind of education outside of the schools. It's a great opportunity area to expand programming, is providing community sex education. And really, the other thing I wanted to highlight is that youth are not using that STI pregnancy prevention methods at a high rate, really. And we've kind of talked through a team what that looks like, but we'd like to see, not the reliance on the withdrawal method for pregnancy prevention, right? We really should be using a condom every time, because we want to make sure our youth are protected against STIs and prevention. So those are kind of our three main takeaways. I do want to mention really quick before we switch to question and answer session. So we are in the process of making a report. It's a slow going process. We do hope to have a draft of the report that will be draft shareable by May 1st. And so we will definitely send that out via email. We also have a website through the social work, the USU social work site that will be posted at. But because you've attended today and you put your email into Eventbrite, we'll be able to share that via email when it's ready. We also recorded the webinar today, so we'll be sending out a link afterwards. It'll be posted on the social work website as well, where you can share it with your colleagues if you think they'd be interested in what we've talked about today. So with that, I am going to go ahead and stop sharing my screen so I can see your faces, and we're welcome to answer any questions you have. So you can put those in the chat box, or you can unmute yourself. So go for it.
Chris, this is Brian Higginbotham. I've got a question for you.
Brian.
I'm really interested by the lack of confidence in one's ability to give consent, and wondering if you could just expand a little bit on the implications for that when it comes to outreach programming or public education, or the lack thereof on these topics.
Yeah, and Brian, that's a really good question, and I failed to mention. So we also have 3 qualitative questions, one of which is like, what would you say or do if you were wanting to tell someone that you don't consent to something? And so we will have those results shareable. It's just there were 900 responses, so it's taking a long time to code those. So I just want to share that first, that we do have that. And what we're seeing initially is that people are really reporting the need to use really aggressive, not only verbal, but nonverbal responses to show this person, I don't consent, which we found interesting because anyways, you can go down the whole rabbit hole. So Brian, I think that, we obviously a couple of years ago in the legislature, it was not allowed to be included in the schools, right? We couldn't talk about consent. And I do think that this data now that we have that says people aren't feeling so confident about giving or giving or obtaining that consent. So I think it has real clear implications for programming. And I would say I would really like policy as well to say, well, in community sex education, we need to be including consent in those conversations. And I think not even sex education, I think sexual health, I think healthy relationships, which I know is one of your areas, Brian, how do we include that in healthy relationships for not only our young adults, but our youth as well, in a way that works for them, so they feel like they don't have to be aggressive and yell and push and say really, explicit things to convey that they're not consenting to something. Does that answer your question, Brian? Okay, great. Carol, I see your hand up, and I know we have a question in the chat too.
Oh, thank you very much, Chris. This is really revealing study, not surprising from my point of view. And I do serve on the Utah Marriage Commission with Brian Higginbotham, so we've worked together for a number of years on legislation, and the Marriage Commission is all about healthy relationships. But let me go back to the bill HB 274 that I almost got passed this year, and the year before I attempted. And I want to bring up that term of consent, because if you followed that bill 2 years ago, I used the word consent to be added to the health education curriculum in 7th grade and again in high school. And the now rather infamous, I think, Natalie Klein, state school board member, who is just harming kids in every way, took that word and sent it out to her minions and used it in a way that turned it all negative. Representative Moss is trying to teach our kids how to consent to sex as young as first grade. And I mean, it just went on like that. So not only here, but around the country, the word consent has become a hot button word in the same way that critical race theory and other things have. So this year I thought, well, I was an English teacher. I thought, well, I'll just change the wording. So I use the term boundaries now. I thought I could sneak that by them, but, and the bill did pass the House, and then there was this terrible incident in the Senate the last night and the last hours, and I think my bill would have sailed through, and then that transgender bill substitute came out of nowhere, and that took up an hour, and then something happened at the last minute on my bill. I had a conservative Republican senator, Cullimore, has 5 daughters. It meant a lot to him and his daughters. And somebody got to somebody and they changed their vote, and it was kind of a cascading effect. I still haven't found out. Maybe Gail Rosika, I don't know. But that I just wanted to give you that background and know that everything in this survey is exactly what I was saying, not to mention what I gave as handouts was that report on child sexual abuse statistics from the Women in Leadership Project at USU, and then the state health department statistics. And, you know, the sensible legislators of both parties said, look at this. Look at the statistics. This is alarming. And everything you've just shown is exactly, the kids want knowledge. Knowledge is power. It's some of the parents that are preventing it. And the one, I can't wait to look at these more longer, but the one that was just not astounding, but not surprising, how many of them learned this at home? It's very low. So any advice, my ability to use this will be, I will not give up on this because our kids need this. And thank you for doing it. So I didn't really have a question other than how can we use that word consent, or should I continue to try and use it in because this has become a political issue. I mean, it's a health issue. It's a safety issue. It's as important or more important than teaching our kids from first grade not to smoke, use drugs or alcohol. We talk about that all through elementary. I taught high school, but Red Ribbon Week, all those things. What did they smoke? Did they drink because they learn about it in first grade? See, that was the kind of judgment they were making. Oh, if you talk about sex and how to protect yourself, that's always been it with comprehensive sex ed. So I'm just putting out this sort of a rhetorical question, but with any of your help or answers to move forward, because you have clearly shown an enormous need for education. And I'll stop talking now.
Thank you for that, Carol. And I see Melissa has unmuted herself, so she probably wants to say something. So first of all, thank you for your advocacy, because this is really important. And we were trying so hard to get the results pushed out for the legislative session. We were a little behind. So we're sorry that they didn't get to you before when you could have used them most. So I apologize for that. And I do love this idea too within the healthy relationships, looking at the idea of boundaries, because I think it's right. Like the idea of consent and boundaries goes so far beyond just like sexual and that it's so many other things. So I think that's actually a really like great expansion term. So yeah, go ahead, Melissa.
All right. So first off, I am so glad you are here. Thank you so much for your advocacy. I'm a little starstruck that you're here. And I so appreciate your work. I want you to know that it's not gone unnoticed.
Thank you.
So a little background for me, I did work in abuse prevention with teaching in elementary schools. So I do have some experience and expertise with teaching about sexual health and sexuality to children. And it was in this abuse prevention education that I realized there were a lot of parents who were concerned about the education coming from someone other than them. They wanted to be the ones to educate their children about sexuality, about abuse, about all of these hard topics. They wanted it to be in a safe place in their own home, and they had no tools to do it. That was the thing that they kept telling me is, how can I do this? Give me the tools, teach me how. But because of the poor sex education they have received, they don't have the information to teach. And that's what got me to go back to school and start my master's degree. And I did my thesis on teaching parents how to be confident in sex communication with their children. That was a cool study. I would be terribly interested to continue if people would like to collaborate with me. That is one of my career goals. But something that we found was that consent was a buzzword. People didn't like to talk about consent. Oh, that means that they will have sex. That's purely sexual, when there's consent and boundaries everywhere for everything. And I love how you brought up the Red Ribbon Week, because that was something that parents could really connect with of, oh, this is preventative. If we can't talk about it, we can't do anything about it. So it was, the program I had worked on was mostly to help parents be able to talk about it themselves, to be confident to do that. And body autonomy was the word that seemed to work the best in my own experience, was teaching parents how to teach their kids to be body autonomous, that they were in charge of their bodies, that the feelings were in their bodies, they had the say about their own bodies. That was something that parents could get on board with. So I hope that helps to answer that question a little.
It does. And I would say it right on with the parents. As a parent, I have 3 daughters now, grown, and grandkids who are in college. And I didn't have that language. We were very protective of our daughters. They were in ballet and lots of lessons and activities. We drove them, picked them up, and always kept track. But you know what? We didn't warn them. We warned them about stranger danger. We did not ever say, if somebody touches you, it makes you uncomfortable. And all 3 of my daughters, sadly, were molested by an extended family member when they were young, and 9, 11, and 12, until the younger one, no, she was 6, said, I don't want to go to so-and-so's house anymore. And so that's been one of the things, the biggest regrets in my life. And I know there are other parents even today, that was a lot of years ago, that still don't know how to talk about. My kids are so much more open with their children. And just one little anecdote. One of my daughters met her husband at USU, and they still joke they've been married 26 years. They still joke about the fact they met in a class called Human Sexuality. Now, I don't know if it's still there, but it was 26 years ago. That they've been married 26 years. Even at their wedding reception, they joked about, this is where we met and we did our homework together or something like that. But I hope you have some kind of classes like that.
Well, and just to follow up, and then we'll move to a couple other questions too. So Carol, and just for a reminder for everyone, so actually this year's survey, we actually hadn't intended collecting a ton of information about sex education and other things. This year's survey was really to test the reliability and validity, so we could do a further larger study this next fall. So what happened was we got a huge sample and we didn't expect it. And we just had so many of our students participate. It just was far exceeded what we ever expected. So this kind of answers the question in the chat from Jessica about if we plan to duplicate it and expand it to other universities. We absolutely do. So this summer, we're going to be working to recruit other universities to work with us to send out the survey. We're going to be greatly expanding the questions around sex education and reducing some of the risk behaviors that we're not as interested in, that we're just used to, for the testing of the reliability, basically. So just, to answer Jessica's question, to go along with what Carol's talking about, there's plans for more. And we really are interested in too, around this sex education question, is circling back to the beginning of really getting more of a nuanced understanding of ranking, who is the first person you go to versus who's the 10th, like what sources are you going to first versus last, and just getting more detailed information about those sources of sex education and how they're using them and who they trust. That's what we're also interested in, trust in those sources. But thank you for all of that, Carol. I'm gonna go to Jody because Jody has her hand raised. What do you have, Jody, for us?
Thank you so much. And hi, Carol. So good to see you again. Dr. Julie Gast and I were kind of chatting for a second and decided that I'm going to speak for a second. So first, I want to just mention Dr. Gast and I rewrote these, well, with a whole team. It was not just the two of us. But Dr. Gast was actually the lead for the revised sex education standards of health education. They were approved in 2019, which means that they were adopted by our schools in 2020. So they've been taught for one full school year and a half. I want to point out that there are some drastic improvements to those. Namely, we now do teach consent in high school. It is taught. And administrative rules R277700-7-1 states that LEAs shall, it is a requirement, adopt curriculum that teaches all the standards. Teachers are required to teach every single standard, every single one. There are now only 30 of them, not 118 like there used to be, so it's doable. And I want to just really quickly say that we have discuss and understand refusal skills, personal boundaries, and affirmative consent as they apply to situations involving pressure to be sexually active, identify strategies that support decisions, abstain from sexual behavior, and discuss the reasons why refusal skills and affirmative consent are necessary to show respect for the boundaries of self and others as they relate to healthy relationships, marriage, intimacy, and sexual behavior, and analyze factors including alcohol and other substances that can affect the ability to effectively refuse or consent to sexual activity or perceive the refusal of others. So we added these standards very intentionally so that students can learn what consent means, how to ask for consent, how to give consent. And consent does not mean always saying yes to sex. Consent means saying yes to anything or saying no to anything. It is being able to say what you are comfortable with. It is consenting to go on a date. It's consenting to share my crayons in first grade, right? Like, it's not sex. And I've been so intentional of going around the state and teaching teachers how to teach consent when it doesn't mean sex. It does not have to be sex. We can consent to what we like. Also, I think it was Melissa that said bodily autonomy, because we have that standard too. Discuss how to clearly say no, leave a situation or interaction, identify and talk with a trusted adult when feeling uncomfortable, afraid, or unsafe, and when it's necessary to speak with more than one adult. That is a standard in K through 6. Has nothing to do with sex. Has everything to do with being able to say, I don't want you to touch me. So I just want to say we have drastically improved, and I know I focused on the consent ones. We also now have really robust sexual, risk reducing standards. Sorry, let me use the right words here. Risk reduction standards. So we talk about condoms extensively. We talk about how, and in 2020, who I don't even remember the representative anymore, but it passed that it is really clear what teachers can teach. They can teach the limitations of contraceptives, the risks, how minors can obtain them, and what they protect you from, which we've always been able to do, but now the law is very clear because we had principals saying, oh, no, you can't advocate for condoms, you can't talk about them. Yes, you can, you just can't tell kids to use them. Senator Reeby's bill almost went through that would have given an opt-in. Actually, so it did almost go. So she had a really great bill. Let me be really clear on this. That was very well received. Our superintendents liked it, the PTA liked it, and actually the Eagle Forum liked it. How does that happen? It happened because she was giving parents an opt-in choice to have a extended health class that would allow the advocacy of contraceptives to be discussed in health. Opt-in class. However, it was not ever heard because Senator Johnson held the bill. That's a whole nother thing. But she had support of everybody on this bill. We crafted that language so perfectly, which was totally about data. It was all about data. The majority of parents want an option for more sex education for their kids. Doesn't mean they always want it done, but they want it to be an option. So we made a bill that would give parents the option of opting into more. Currently, you can only opt out to some, right? Or all. That is the only option, is opting out. We wanted, and I think she's going to run it again, we wanted an option to opt in to more. And we have perfect language to do it. Okay, I'm done.
And thank you, Jody.
Bravo to Dr. Gast, by the way, though, because she crafted the language for these standards. And in 2 more years, y'all, your students will have learned these standards in their high school classes. It's going to take 2 more years, though, before the universities get what the high school kids are learning, because they're getting that education in 9th and 10th, and we're only on year 2 of them learning these new standards. So it's going to be 2 more years before those kiddos get to you. Just a little bit of a data point there. Okay, I promise I'm shutting up.
That's very
really
helpful.
Yeah, interesting to see how the data changes.
Yeah, it's making me question if we run the survey in this year. So I just want to address, we only have 2 minutes left. So I want to address Jessica's question. That is, are there community comprehensive sex education classes that are either offered directly to teens or parents? So there definitely are. What we have learned from our colleagues at the, at Utah Public Health is that there's a lot more in the urban areas and it's much sparser in the rural. So we do know some folks in the rural communities who are doing them, but there's some counties where it's really hard to get anyone to do the community sex education just because of, you can imagine why that's hard to do in rural communities in Utah. And so there are, and they're in the urban areas, we have a lot of more options. And then in the rural areas there are some that are happening. So, and I know like Geraldine put exactly that, here's an example of one that we're doing in Ogden. So I do know like our teen prevention programming person, Elizabeth Gerke, you could always reach out to her. She generally knows what's going on with the community programs in the state. And I see Mary that we'll reach out to you for sure. Any other questions that we can answer before you hop off? We have about 1 minute left. Nope, I don't see anyone getting excitable. Well, thank you so much. We are so excited to share that we could share this with you. We are going to be working on another round of a survey that's more generalizable. We can't wait to share our report with you. We are definitely all about sharing our results and getting it out there because this is all really, we want to improve, the lives of our Utah youth. And so however orgs can use this, we want to support your grant writing or whatever we can do. Please reach out to our team and let us know. We're happy to give you even just the data tables so you can at least have some beginning work while you're waiting for other things. We did already present at UPHA. We're also submitting to APHA, the national conference, and any other Utah things you see in Utah that we could come present, we'd love to, because we just want to make sure, especially that organizations get this information and they know they can use it, because we really want to get it out there. So thank you, everyone. Have a lovely day. Thank you.